I'm Peter Fale. I chair the Friends of Blandford Community Hospital, which is one of 11 community hospitals in Dorset. They are all administered by Dorset Healthcare Foundation Trust, who is one of the providers. The NHS is divided into providers and commissioners. Early next year, in April, the commissioners will change to the clinical commissioning group, which is run by the GPs. In essence, this means that the GPs will decide what healthcare needs there are, and then the managers will make sure they are provided. At the moment, it's the other way around. The managers decide, having had suggestions from the GPs. So we hope that that's going to mean that the people who really know what the health needs are will be in control. We are fortunate in Dorset to have 11 community hospitals, because the main theme is to treat people as close to home as possible, and when it is not possible to treat them in their own home, then the next best thing is a community hospital close to where they live. This provides a much more intimate and personal service than the acute hospitals, which are very busy and high-powered, although of course we do admit that there are situations where it is important that we do have acute hospitals. The Friends of the Hospital provide facilities, they finance training for staff in the hospital, but more, they also work in the community. We provide finance in the community. We also have volunteers working there who provide transport, and we have up to 500 trips a year now taking place, transporting people to hospital, to doctor's appointments, and going on outings. We have a minibus which is equipped for wheelchairs, so we're able to take disabled people shopping and on other trips. It is hoped that we will, by next year, have 2 minibuses so that we can expand, and we are, of course, always looking for more drivers. In addition to this, we would hope that we do represent the public's needs, and we are fortunate that we do have a voice in the decision-making bodies. There was an important meeting on the 6th of December, which involved a great number of those who are able to make decisions, such as the director of medical services at Poole Hospital, the local GPs, people from Dorset Healthcare, from social services, and the GPs who are on the new clinical commissioning group, and we discussed the possible services that could be introduced into Blandford. What has happened in Blandford is that there has been a reduction in the number of inpatient beds. There is now just one inpatient ward, the town ward. The Portman ward is at present empty, and it is hoped that we will turn this into a day treatment centre, and a great deal of the Friends' money will be poured into this project to enable various services to be introduced there. The meeting on the 6th discussed what could be done. Various ambulatory services were discussed, such as chemotherapy, blood transfusions, and then an extension of X-ray and ultrasound. So again, probably new equipment will be done. We just hope that there will be a pain relief clinic developed, And we also hope that there will be some ophthalmology. It was thought that possibly this would link up with a cataract clinic which is being developed at Fale Hospital. And so the meeting ended by a determination to push these things through as quickly as possible, hopefully early in the new year. So the future for the hospital is, I think, a very exciting one, and I think it will become increasingly relevant to produce the healthcare that this area needs and deserves.